Welcome back and thank you for staying with us. Joining us now to discuss the latest data on COVID-19 is Bhekisisa founder and editor-in-chief Malan. Good afternoon to you and thank you so much for joining us. Well, Mia, can you just talk to us about the variants that are prevalent in the UK and India, which have now been detected in patients right here in South Africa?
Yes, as you may know, we have detected 4 cases of the variant first detected in India and 11 of the variant first detected in the United Kingdom. And the question is, of course, what does this hold for us in terms of a third wave? Do we need to be concerned? Now, the issues that we need to look at of concern would be, are these variants more transmissible and do they escape immunity? In other words, would they not work well with vaccines that we currently have? Now, the data that we have so far show us that the variant first identified in the UK is definitely more transmissible than the original form of the coronavirus that causes COVID-19. But it doesn't seem to affect vaccines, so vaccines still work very well in that case, and it prevents people from falling severely ill. In the case of the variant first identified in India, we do not yet have conclusive data. We have some preliminary data that could possibly suggest that it could be more transmissible, but we really don't know. But what we do have is we've got some data from the UK that shows that people who had been infected with a variant first identified in India, that variant has spread to the UK, and that were then vaccinated didn't fall severely ill. So it seems as if the current vaccines that we have still work quite well against the variant first identified in India. And that's good news, because what we want to prevent with a third wave is for people to overwhelm our health system and for people to die. And so at least that's some good news in that regard. But what we would like to do at the moment is to vaccinate people, and we would like to perhaps postpone the third wave a little bit so that we have time to vaccinate more people. So our vaccination rollout should really become more urgent, and we should be able, I really hope we will start on May 17th.
I actually wanted to ask you if you do think we will start on May 17th. I mean, I know that the country has received various batches, small and increasing amounts of vaccines from Pfizer, BioNTech, you know, the AstraZeneca vaccines, as well as the Johnson & Johnson injections. Do you think the country will be ready?
It is so hard to know that because the communication from the health department is inconsistent. So, for instance, we would want to know, are all the vaccination sites prepared? And we don't know that yet. We haven't had communication. It's a week, next Monday, not tomorrow, the Monday after that. The 17th, we need to start to roll out, and people do not know where would they find their shots from. They also don't know when will they receive a message from the system on which you register for the vaccinations for those people of 60 and plus. The other thing that we haven't heard about is we received Pfizer vaccines on May the 2nd, and we know they went to the Bloemfontein, to the University of the Free State to get tested for safety. Some samples went there. So why have we not heard when will the vaccines come out of quarantine? Would we, for instance, be able to start this week already with the Pfizer vaccines while we're still waiting for the Johnson & Johnson vaccines? So it's very, very hard to know if that will start, because we haven't received information that we can use to know how prepared we are. And I think in this whole vaccination rollout, one of the biggest challenges has been the inconsistent communication that we've received. I've often personally phoned the health department for information and got contradictory information from different people in the department. I think another issue that we're not yet entirely sure about is what will happen to non-South Africans who don't have IDs, so who don't have refugee numbers or asylum-seeking numbers? Because the health department says there needs to be some form of ID, and we've heard the president this week in Parliament say there will be some sort of unique identifier that they could use, but we don't have details. And all over social media, questions have been asked about this. Journalists have been calling for information about this, but nothing has been announced.
And if we just reflect on this week's numbers that have come forth regarding COVID-19 in the country, Amir, which provinces would you say are becoming hotspots?
So I think clearly there are 4 provinces that we need to be concerned about. That's the Gauteng, Free State, Northern Cape and the Northwest. In Gauteng, we've heard some experts say that we could be 3 weeks away from a 3rd wave. Of course, people have different opinions about this, but we've also, for instance, in Gauteng heard public health officials saying that they've seen that people are less adherent to public health measures such as social distancing and mask wearing now. And the only way that we can contain a 3rd wave is 2 ways, is to adhere to public health measures and to vaccinate as many people as we can. We're not very far with vaccinations. We haven't started other than in the Sesonke trial. So what is so important at the moment is that we do adhere to those measures, and because of the importance of that, we may see, some experts say we may see an increase in lockdown levels, for instance, to level 3. That has not been announced, but we know the health department has said that they will announce measures soon of what they will do to contain the spread of the new variants that have been identified in the country, and that could mean either lockdown levels or look at who comes in at our borders. But we know that travel bans really only work if you get it very, very early in a pandemic or when a variant of concern arises. So it may be too late for that, but we haven't heard any announcements with regards to this yet. But it would be very, very important to have measures that will now contain the community spread of these new variants.
And just on the issue of travel bans, some people have actually raised concerns regarding the variant that has come in from the one that was discovered to be prevalent in the UK, as well as the one from India. Considering that we do have cases already in the country, should there be travel bans considered on people flying in directly from the UK and from India?
So I'm, of course, not the expert who makes the decisions on that, but the argument generally is that once a variant of concern is already in a country, the focus should be on preventing the community spread of that variant, because that will be far worse than the number of people coming into a country. There would be far fewer people bringing the virus into the country than they would be spreading the virus in the community, because that will then go much faster. So the focus at the moment would probably be on containing community spread rather than having very severe measures to prevent it from coming into the country. Not that that is not important, but the community spread would be a big focus.
And I mean, the Department of Health has already mentioned that they are busy with contact tracing currently. I mean, looking at the 11 that have that variant that is prevalent in the UK, do you think that perhaps that could be a sign of a community spread already starting?
Well, the health department yesterday night announced that there's already community spread of the variant first identified in the UK. Because how do we know that? Because the samples that they sequenced in which the variant was were samples from people who hadn't travelled anyway. So that tells us that there has been community spread of the samples. In the case of the variant first identified in India, those 4 samples were all from people who had travelled from India to South Africa.
And just lastly, with regards to the local figures again, do you think that we're seeing an increase in people actually losing their lives from complications with COVID-19?
Well, what naturally happens when infections increase is that the number of people who fall severely ill also increase, because there's always a certain proportion of people falling severely ill, and if the numbers increased, then there would obviously be more people falling ill. So that would generally be a natural consequence of infections increasing. So what we would really like to do in this country is to start to vaccinate people, as many people as we can, as soon as we can. And that's why it's so important that we know whether we will start on the 17th, and once we do that, that we know how fast the vaccination rollout will happen.
Well, Mia Malan, thank you for joining us. So that was the founder and editor-in-chief of Bhekisisa, Mia Malan.